Welcome to The Perfect Workout, where we bring you expert exercise advice, practical workout tips, and inspiring stories from the world of fitness and wellness. I'm Jordan Thompson, and today I am sitting down again with Dr. Sean Pruess. Sean has over 10 years of experience as a personal trainer. He wrote the Heart Healthy Lifestyle Guide to Prevent Type 2 Diabetes, and Sean holds a doctorate in kinesiology and a master's in exercise and wellness. Welcome back, Sean.
Thank you for having me again, Jordan.
Today, we're going to dive into a topic that I don't really feel like you hear too much in the health and wellness space, and that is the topic of visceral fat, and specifically visceral fat around the heart. So let's just dive straight in. And Sean, could you briefly just tell us the difference between that type of fat around the heart, the visceral fat, and other types of fat, in the body?
Absolutely. There are different types of fat in the body. We tend to look at fat as bad, right? If you gain fat, it's not a good thing. If you lose fat, it's a good thing. And that the underlying message is simply that fat is negative. But that's not really true. Fat is much like business, location, location, location. When it comes to fat on the body, the truth is it's a little bit more complex. Fat is not all bad in the body. In fact, some fat might even be healthy. We have two major types of fat in our body. There's subcutaneous fat, which simply means under the skin. And this is the fat that you might be able to pinch around your waist or pinch on your arms or your thighs. This is the fat that's under the skin. It's actually not unhealthy in a lot of places. In fact, there is research showing that people with more hip and thigh fat are actually healthier. It's a healthy place to store fat in your body. On the other hand, there is another type of fat that's not so healthy. That's visceral fat. Visceral fat is in your midsection. It's the fat around your organs. It actually can interfere with the function of your organs. In a certain case, there's visceral fat around your heart and inside your heart, which is referred to as pericardial fat. And this fat actually can have really damaging impacts on your heart health.
And I definitely want to hear more about that, what some of the risks are. But how do you accumulate that kind of fat? Like, how do you? I mean, we know how we gain fat in general, right? It's generally more calories you're eating than you're expending. But how do you gain that fat you're talking about around the heart?
Fat around the heart and visceral fat in general come from a few factors. We always gain fat when we're over consuming calories. So there is a factor of simply, are we eating too much? And if we are, we're gaining more fat. And naturally, some of that's going to be subcutaneous and some of that's going to be visceral. There are some things that seem to even persuade our body to put even more fat in the visceral fat deposits. One of those things is having a sedentary lifestyle. A sedentary lifestyle is not just simply we don't exercise. It's an excess of sitting. There's a number of studies that show when people are sitting for many hours per day, especially when those sitting periods are uninterrupted, we tend to store more fat in our midsection, including in our visceral fat deposits. Some other causes, a lack of exercise, and also poor dietary habits. It's shown that people who are eating a lot of trans fat and who are eating excess of calories in general often tend to gain more visceral fat, the fat that we're actively hoping we don't gain.
Okay, so a moment ago, you mentioned that there are some potential health risks that come with having excess visceral fat. What exactly are those?
There are a number of health concerns that come with heart fat. There are issues that we are at a greater risk for when we have more heart fat, and there are actually issues that the heart fat directly causes. So I'll start with the risk first. When we have more heart fat, we're at greater risk for developing cardiovascular disease and at a greater risk for developing diabetes. Obviously, we don't want either of those things, and those are both severe chronic health conditions. But it's not just the fact that we have a greater risk for disease. There are also issues that come from the actual pericardial fat. First, fat tissue creates molecules called cytokines. These cytokines actually can decrease or increase inflammation depending on where they come from. In the case of pericardial fat, the cytokines that these fat cells produce actually increase inflammation in our bodies,
Hmm.
meaning they are causing inflammation which can directly contribute to the development of heart disease. Also, the pericardial fat can actually reduce left ventricular function, which, if you're listening to me and you're wondering, what is that? What does that mean? The left ventricle is the first section of the heart that blood pumps into. If pericardial fat is actually able to interfere with the function of that section of the heart, it means that we're going to pump less blood through our heart. So it's actually interfering with the function of the heart and ultimately the amount of blood that the heart can pump out to the rest of our body, which has a number of concerns that comes with that.
Dang. So this is kind of a big deal. This is something that we want to be able to manage. So let's do what we do and give the people the good stuff. And let's talk about how we can use our healthy lifestyles, exercise to either prevent or manage having excess visceral fat.
We do want to manage it for
Mm-hmm.
sure. As we talked about, there are very serious health issues when it comes to having more pericardial fat. So, as you asked, what do we do to get rid of it? There are a couple things. Some answers that you would probably expect are shown to be effective here. If you smoke, stop smoking. That's shown to be very effective. If you drink alcohol often, decrease your consumption of alcohol. That's shown to be very effective. There are two other things that are maybe less obvious that can also help. First is to decrease your hours of sitting per day. Can you, if you're working at your desk, can you replace some of those sitting hours with a standing desk or a treadmill desk? If you can't do that, it's actually shown to be effective to reduce heart fat if you could simply break up your sitting periods. If you're sitting nonstop for 4 or 6 or 8 hours, set a timer to get up every half hour or every hour. Even the simple interruption of your marathon sitting periods can help you with decreasing visceral fat, including heart fat. Finally, something that's shown to be very effective, strength training. Strength training is actually more impactful for decreasing heart fat than aerobic activities. If you want to decrease your pericardial fat, strength train regularly, at least twice a week, to decrease your fat.
Perfect. Okay, so let's recap that. Stop smoking. If you drink, cut back on drinking. Stand up more, sit less, and then get some strength training workouts into your weekly regimen. Is that right?
You've got it.
Okay, perfect. And thank you all for listening. For more tips on health and wellness, nutrition, exercise, and of course, strength training, be sure to subscribe and head to theperfectworkout.com.